Just want to comment real quickly on the recent vegan wars because why wouldn't we war with each other? And a lot of it is really nuanced and it's being taken out of context, but it is social media. And there seems to be a debate between younger, predominantly plant-based doctors and the older, kind of old guard that really started the plant-based movement, at least the medical side of it. And the debates to me are fairly interesting because there is legitimacy on both sides. Recently, this really came to a head because Dr. Greger posted a video that said that there's no such thing as left main disease, which is part of the heart, a vessel in the heart, and that angioplasty doesn't work or stents don't work. And of course, as usual, he presented his data, but as usual, he was accused of leaving data out and that this was cherry picking. First of all, the people on both sides of this are brilliant, great doctors. And they all want what's best, I think, for humanity and people in general. I know Dr. Greger. I was at a meeting with Dr. Greger once, giving presentations, and I saw him with his arm around a lady in the back, and I went over, I was like, what's going on? He's like, oh, she's having a hypertensive attack. I'm going to help her get to the hospital. I mean, this guy really cares about people. He is a genuinely good heart. When he says that there's no left main disease, it can be problematic because there is a diagnosis of left main disease, heart disease, and that diagnosis carries with it a poor prognosis. So to say there's no left main disease, that means someone might have left main disease and say, oh, well, Dr. Greger says I don't have left main disease because there's no such thing as left main disease and they don't get it treated. Untreated left main disease has a very high rate, I think something like 50% mortality. So that could be extremely problematic. Now, Dr. Greger does not mean that there is no left main disease. What he means is that cardiovascular disease is a disease of the whole heart, of all the vessels in the body. In other words, people with erectile dysfunction have a problem with their vessels and they can have a higher rate of heart disease because it is a systemic problem. And I think that's what he's trying to say. What doctors like Dr. Bellardo, who is a brilliant young doctor, is trying to say is that this could be misleading to people because Dr. Bellardo is in an interesting situation. She's working at a predominantly plant-based institute, and she's getting patients who are coming to see her about heart disease, but they want to do a plant-based diet. A lot of them want to avoid medications. Now, they want to avoid medications because they've heard from Dr. Esselstyn and Dr. Ornish and Dr. Greger that they can avoid it. Now, are Dr. Esselstyn and Ornish and Greger wrong that you can avoid it? No. Plant-based diet is a great way for decreasing heart disease. Are you guaranteed to avoid it? No, definitely not. Could you possibly need statins, and even if you're on a plant-based diet? Yes. In fact, I may need a statin. My latest LDL is up. My cardiac heart scan looks great, but I've got a familial hypercholesterolemia, and I'm very comfortable with the fact that the data shows that I would be better off on a statin, even though I follow about a healthy diet as a human being can follow. So there is a legitimate problem with making it sound like plants are the absolute answer to everything. Those problems are twofold. Number one, for the patient, because if they think that they can avoid medical therapy just by eating plants, they could be avoiding a potentially very helpful thing to help them live longer and alleviate symptoms. I treat people with medicines, even though I also treat them with diet. I treat people with surgery, even though I also treat people with diet. And it's that mix that I think a doctor that is schooled in both is really the ultimate in treatment process, which is not to say that I think that, plant-based diet can't prevent disease. Obviously, I believe it can. I just don't believe it's going to in everybody, and that I do believe that there is a role for pharmaceuticals, and there is a role for surgery, and there is a role for Western medicine. Otherwise, I wouldn't practice Western medicine if I didn't think what I was doing didn't help people, and obviously it does because I see that in a day-to-day practice. And that brings up another issue because there's another complaint in all of this that People are saying that, Dr. Greger has never treated a patient, and that's partly true too. I can't emphasize this enough. You could read all the papers you want. I'm constantly reading papers. There's always a paper on my desk that I am reading. And I read it in context with what I do in my clinical practice and what I see in my clinical practice, because there are times that I read something and I'm like, that just isn't what I see in a clinical practice. And in clinical practice and experience really does play into this a lot. I value my PhD colleagues that are putting out the research, because I can't sit there and do research all day. I got to treat patients. But at the same time, I don't take what they say absolutely as it. I also rely on clinical expertise, both mine and my colleagues. And so this is all pretty nuanced. Dr. Greger is not wrong. Dr. Bellardo is certainly not wrong. They are both right. They are both excellent caring physicians. They just have a little bit of a different perspective. And if we looked at this from nuance, if people were able to look at this with nuance, this wouldn't be an issue. But people aren't able to do that. There's, people are like, oh my God, the cardiologists are saying that Dr. Greger is wrong because he said there's no such thing as left main disease. Therefore, I will not believe anything Dr. Greger ever said. That's ridiculous. Likewise, for people to say, oh, well, these doctors like Dr. Davis and Dr. Bellardo are paid for by pharmacy, and therefore they're just trying to push their come on, that's ridiculous too. So use some nuance. These wars are a little bit manufactured in the social media world. There are legitimate concerns on both sides of the field. So, just listen to these with good judgment. Hope this helped.